Hi everyone. I'm Dr. Payal Sharma Kamath. I'm a psychiatrist and a counselor. I am working with Ask You Look in Mind Clinic, which is there in Borivali, Bombay. So today I'm going to discuss about mental health matters, which is related to female. So why women mental health is so important? According to the prevalence of depression, there are 40% chances a female can have an episode of depression, which is more 40% more than a male, right? So if we also look at the data about suicide, there are more attempts which are done by a female than a male. So there are more women who attempt for suicide pertaining to any reasons, whether it's depression, anxiety, interpersonal problem, but there are more cases in females. Anxiety issues, which is now the second most common illness in the world. So it has surpassed all the cardiovascular problems, diabetes, depression. So, as an epidemiology, of course, we have understood that the mental health matters is more prevalent in a female. And why and how we see these cases more in female. So, one of the factors is the kind of gender roles that we have. A female has to go through a different way of behaving, thinking, perceiving the world. So some of it is genetically and some of it is society bound roles. So as a daughter, as a wife, as a daughter-in-law, as a mother, she has to fulfill roles which are extremely different from a male. So, one is the gender role. Second is also the kind of hormonal changes a female goes through in her life. During the time of menses, during the time when they get pregnant, even when they have menopausal symptoms, there is an imbalance in the level of estrogen, progesterone, prolactin level, oxytocin, which these hormones affect our mental status as well. They just don't work on your reproductive system, they also work on your brain. So it will modulate your mood, how do you feel, what kind of judgments you're taking, how you're reacting, how you are behaving, your sleep, your appetite, your feelings, your emotions, everything is done by are getting affected by these hormones. So based on these hormones, there are different disorders which is restricted and limited to a female. There are other factors, like for example, domestic violence, abuse, interpersonal issues that a female has to go through, work related issues, sometimes managing the household and also managing the work at the same time with the equal dedication and efforts. So these external and internal factors make them more prone to have certain mental illnesses like depression, anxiety. There is premenstruation dysphoric disorder. Let me explain you about the premenstruation dysphoric disorder here itself. So these are the symptoms. There are few symptoms which happens before the periods. There may be significant amount of mood swings. There's going to be irritation, anger, not able to sleep, feeling of anxiety, panicky. You feel quite jittery. There are many physical symptoms of headache, neck ache, body ache, stomach pain, cramps, diarrhea, constipation sometimes. There are physical symptoms like sweating and some changes in the skin that happens during the day before the period happens. Sometimes these symptoms become severe and the patient can also complain of suicidal thoughts, feeling of hopelessness, feeling of lethargy, helplessness, loneliness, and severe symptoms can also result to disruption of a person's life. So, of course, if anybody is having similar kind of symptoms of PMDD, which can be easily treated with the help of counseling, lifestyle changes, and few medication, but it needs to be evaluated by a mental health professional such as psychiatrist and a gynecologist to first diagnose it and then go ahead. You can go ahead with the counseling, but it's an emergency situation, you should meet a psychiatrist first. Then there are other symptoms that happens during the pregnancy because of the similar reason that I explained it to you, the hormonal changes. So during those time, the person can have a female during the time of pregnancy or just after the delivery. They may have symptoms of postpartum anxiety, postpartum depression, postpartum psychosis. The similar kind of symptoms can happen during when a person is in a pregnant state, where the person feels extremely restless, anxious, palpitations, panic attack. As I explained, the symptoms of depression and PMDD, the similar kind of symptoms can happen during PMDD. I want to give a special emphasis on postpartum psychotic disorder. To diagnose a person with postpartum psychotic disorder, you need to see if a person is aggressive, she becomes agitated, aggressive. There are significant behavioral changes. There are, sometimes they become suspicious. Most of the time, they become suspicious about that somebody is going to come and harm them, somebody is going to come and harm the baby. They feel sometimes, quite agitated because they're fearful that the baby can be harmed by someone, and they constantly check upon on the baby. They feel that somebody has done a bad magic on them or the baby has been replaced by somebody else. And that also leads to a lot of behavioral aggressiveness in the house. And where they can hurt themselves, somebody else in the family, also the child can be hurt in the process. So this is a very emergency situation where it has to be directly taken to the need to the psychiatrist. To explain what kind of treatment is done in postpartum psychosis, these are medication. No counseling can help in that phase because it's an emergency. The counseling process is necessary, but it takes months and years to understand few of the things, to go through the whole process. That person who is suffering from postpartum psychotic disorder is not connecting with the reality. So for them, therapy does not work. Medications will. So we have to break the stigma and we have to go to the psychiatrist because it's a situation which cannot be handled by any other profession. Let's go ahead and also discuss about postpartum depression. A female also, the similar symptoms of depression are there, but few of the times the female is unable to connect with the child. They feel that their identity has been lost in this process. They are unable to accept the role as a mother because they feel that it's too much to handle, and necessary is too much to handle. So there are going to be the low mood, sad mood, which is persist for days and days together. There is hopelessness, helplessness, feeling that I can't deal with this anymore, and there are suicidal thoughts during this time. And the person also feels they are unable to take care of the child, and it is the child's need is also sometimes neglected during the process because though how much a mother wants to, but because of the depressive symptoms, she's unable to do that. Of course, counseling and a better support system can help her to recover. But for the full and recovery, she needs to see a psychiatrist. There is no other shortcut here. There is no other path which will help a female to recover. She needs to see a psychiatrist, start with the medications along with the counseling. But there is no ifs and buts, we need to get it treated. People who are more prone to have any psychiatric issues during the pregnancy and post pregnancy are more who have family history of certain illness, certain mental illnesses, or they have an episodes of mental illness during the marriage, before the pregnancy, but discontinued the medications because they were pregnant, or also when the female also has certain stressors like death of the baby, or there was some kind of comorbid meaning any kind of medical illnesses with the baby, or if they've gone through a very traumatic and a prolonged labor, or where they has a significant amount of medical problems which has contributed during the time of pregnancy, or any kind of other external factors, stressors can also act upon their mind. Let's go ahead with the journey of reproductive cycle. We also see a lot of changes during the menopause. So there are depression, anxiety, panic attacks, irritation, suicidal thoughts, quite significant during the time where a female goes through menopause, and also postmenopausal symptoms. Along with all these symptoms, we also see sexual problems. A lot of females go through sexual disorders in their lifetime. So there is vaginismus, there is dyspareunia, which means painful penetration, there is fear for sex, there is anorgasmia, whereas no matter how much a patient wants to, and they are as a partner, both of them getting involved in an emotional act of sex, but the orgasm is not getting achieved. So this is an orgasmia. So there are many sexual disorders which can be seen in a female and as quite common as in a male. So and they are completely treatable. We also see more of panic disorders in female. The reason again being a lot of hormonal changes that happens, and there are more somatic symptoms. What I mean by somatic symptoms are bodily symptoms like migraine, headache, ulcers, acidity, respiratory issues like breathlessness, asthma, and also skin disorders like acne and skin picking disorders and alopecia. So there are many disorders, body disorders, which are which are intrinsically linked with your mind. So a female are more prone to have these symptoms. Again, the reason being because they have different biology as compared to a male, and emotionally also they perceive things differently. The way they express their emotions are also different. How a man can express their problems in a in a different. Sometimes they become loud, sometimes they fight, sometimes they do go around and outside, go for a bike ride and meet their friends. Unfortunately, females still in our society are unable to vent out their emotions. So generally, it comes and it appears in the form of somatic symptoms. So we need to understand that इसका तो ऐसा ही है is not the right thing. Maybe and a lot of time we see husbands and telling them कि इसका तो हमेशा का ऐसा ही है, she behaves like this only, उसको हर बार सर दुखता रहता है, she complains of acidity all the time. It's because she's emotionally unable to vent it out. There's some kind of stressors which are always there. So of course counseling is a very important part, helping them to express themselves in a more positive way, and that is how we will be able to address this problem. So that's all for today. A very short video but explanation about the women mental health. I think we all need to understand. We need to see the warning signs, and please refer the patient to the right person because we want our patients to recover. So that's all from my side, and take care. Bye bye.